Hey my nurse babes, welcome back to my channel. And if you're new here, welcome. Thank you for joining. My name is Brittany and you're watching A Dose of Nurse Bae. So today we're going to do something a little bit different. I usually make content for nurses, also things just related to health and wellness, lifestyle, anything that I find can be helpful and uplifting for us. But today I'm going to give some special attention to the mommies to be, all of the expected moms out there. This video is going to be brief. I'm going to try to keep it under 8 minutes. And we're just going to talk about some things that can help you to have a smoother labor and delivery process when you deliver in the hospital. So just a little bit of background about myself. I am a registered nurse and I have a background in labor and delivery. I am currently working as a lactation consultant. I am a international board certified lactation consultant, aka an IBCLC. So number one, let's go ahead and get the elephant out of the way. The elephant in the room is that Rona. It can be very stressful thinking about going to the hospital during this time. I would encourage you to already know who's gonna be joining you in the hospital. Most hospitals are only allowing moms to have one partner with them. So just go ahead and mentally prepare that this is something that you're probably going to have to experience, and go ahead and figure out who that designated person is going to be, whether it's hubby, mom, sister, whoever is going to be with you. This video, just to backtrack a little bit, I want to specifically talk about how to increase your chances of having a natural, smooth, intervention heavy labor in the hospital. Okay, I'm pretty much a holistic girl. I don't believe in a lot of interventions. I think that birth is natural and most people birth just fine without any unnecessary interventions. Now, in the event that you need a little assistance, okay, you deal with that as the time comes. But for the most part, I really am an advocate for just letting mom's body do its thing. So the second thing that I would talk about is not being afraid of birth. So go ahead and surround yourself with content that help you to understand the birth process so that you're not completely unaware of what that looks like. Also, watch positive birth stories. There's a lot of YouTube videos where people share positive experiences about their birth, and try to avoid anything that's negative or anything that is just like overly dramatic about birth. To be honest, birth, it can be eventful. It is a major event, but it's really not as dramatic as you see on the TV. My first time seeing a delivery as a labor and delivery nurse, I was just fascinated with how uneventful labor was until it's time for the baby to actually come out. I saw moms sleeping in between contractions, I saw moms laughing in between. So I was just like, wow, it's really not like how it is on the movies. Or it can be. Every now you can have some dramatics, but for the most part, it's just a natural process that you go through. So I would definitely recommend that you familiarizing yourself with the birth process and just getting a little bit of education and understanding about that area so that you are more in control because you know what to expect. The next thing I want you to do is make sure that you have a healthcare provider that is supportive of your labor plan, of your desires, and that you're communicating with your healthcare provider what exactly it is that you want, what you envision about your birth, but at the same time, be open to change, okay? So we're gonna expect that everything's gonna go well. You're gonna go ahead and put it in your mind and envision that you're gonna have a smooth birth with no interventions, but just be open to change because as we know, life happens. But as long as you've been in communication with your doctor, everybody's on the same page, that kind of helps things to go smoother. And not all doctors are as supportive of natural birth. I'm just being honest. Not all doctors have the patience. So that's one thing I would really encourage you to do is find a healthcare provider who you feel comfortable with that supports your wishes, and also research who is covering your healthcare provider in the event that your healthcare provider is not able to attend your birth. They can't work 24 hours a day, 7 days a week. They do have to have downtime to recover themselves and spend time with their families. So you may deliver on a day when you're physician is home or off, and the covering physician will be covering for that doctor. So go ahead and familiarize yourself with who covers this doctor. Who does this doctor work with? So you can do a little research into them as well, because you may find that you wouldn't want them to touch you with a 10-foot pole. But at the end of the day, you know, proper preparation prevents poor performance. Just do your research, do your due diligence so that you have an idea. The next thing that I would suggest is definitely be prepared. You want to start getting your hospital bag together, I would say around by around week 35, and just be ready to go just in case you need it. You don't have to bring everything. The hospital usually supplies you with everything that you need for while you're there. Okay, now there are some little luxuries that you might want to bring from home, such as a comfortable pillow, because the pillows in the hospital tend to be flat and uncomfortable. So if you have your favorite pillow, or you want to bring your boppy, just those little cozy things to make your stay a little sweeter, by all means go ahead and do that. But don't feel like you have to, you know, bring the whole world. Just bring the essentials. You just want to be as comfortable as possible, especially if you are planning on, you know, breastfeeding. It's, you know, it's a big adjustment. Babies feed very often. They're feeding every 2 to 3 hours, sometimes sooner, and that's normal. And we want you to nurse the baby on demand, because the more that you feed your baby, the more milk your body will start producing. But things usually go smoother when mom is comfortable. If you're cold, you have to bend over and arch in different ways, and you're just uncomfortable because you have no pillows to tuck under you and support the baby, it can be, you know, just a little frustrating. So bring the essentials of what you need, and maybe just a little bit of fluffy things to make you feel more comfortable, but don't overdo it, because you won't be there for very long, and the hospital usually does supply most of what you need while you're there. Another thing that you should do is share your birth plan with your nurses as soon as you get to the hospital. Now, once again, not everybody is all the way supportive of birth plans, unfortunately, but most nurses, okay, really do want to honor your wishes. They want you to have the birth of your dreams, okay? So definitely when you first get there, make it be known your plans, your desires. But again, with everything, just take it with a little grain of salt that sometimes things do go differently than we expected, but still being hopeful that things are going to go the way that you want. But I'd say the biggest part of having a successful, unmedicated, or natural, no intervention birth is being mentally prepared. That's almost, I would say, 95% of it from a nursing standpoint. A lot of moms, and you never know what it's going to be like until you get there and you go through it. Even if it's not your first baby, every pregnancy is different, every labor is different, so you may have a different experience than before. But just mentally preparing for birth and walking in there without fear. There are some great labor techniques that are out there. One of them is I believe it's called the Hypnobirthing. I've seen moms use that and do very well with it. Another one is the Bradley method, something, I believe it's something like that, the Bradley method. There's a lot of resources out there to help moms to prepare for birth. So that will be my biggest thing for you, is to just go ahead and begin to prepare before you get into the hospital. And know that it is a big adjustment. And if your wish is to breastfeed, I have to go ahead and just throw this in there because I am a lactation consultant. And a lot of moms are very shocked at everything that breastfeeding takes in the beginning. So some babies latch on right away. Some babies take a little time to get the hang of it, but just definitely keep trying, okay? You want your baby to be skin to skin with you as soon as possible after birth. This basically sets you up for success with breastfeeding because the baby's comfortable, it's close, and as soon as you see the baby starting to give you feeding cues, you can go ahead and offer the baby the breast. And when babies are skin to skin, place skin to skin on mom's chest, sometimes they'll often self-attach. So the earlier, the better. If you're in a situation where you have to be separated from your baby, maybe you deliver by C-section, as soon as you and your baby are reunited, I would encourage you to go ahead and try to initiate breastfeeding. And if your baby has to go to the NICU, I would encourage you to go ahead and start pumping as soon as possible, to go ahead and start that process of stimulating your body to begin milk production for your baby. Okay, it's very, very important. And remember that you're not alone. If you're having trouble with breastfeeding, you're having trouble with positioning, you're having trouble with pain, breastfeeding, we don't want it to hurt. It should feel comfortable. If you're having trouble, please don't feel alone. Hit your call button, call your nurse, ask for help, and we'd be more than happy to help you with your needs, okay? But yeah, so just to wrap it up, biggest thing is going to be just preparing, okay? Proper preparation prevents poor performance, and just be open to change, but hopeful that your plan will go exactly the way you want it. I'm a big believer in speaking life over yourself and visualization. So put all those things into practice as you prepare to deliver your baby. One tool that I wanted to mention to y'all that you might want to invest in is some type of feeding and diaper logbook. Newborn babies, they eat, they sleep, and they poop. And if you're breastfeeding, it's important that you alternate your breasts to make sure that both of your breasts get stimulated to produce milk. You're gonna wanna track the baby's pees and poops because that's a sign that baby is taking nutrition from you. So some type of tool to help you to keep track of all those things is helpful. I really like this book for moms, and it has slots that you need to remember which breast you fed on, how often the baby is feeding, and there's some tips, just some basic tips to look for to know that your baby is getting enough. So if you want a good book, I'll put that link down in the description box below. It comes in blue for boy, and pink for girl. So with that being said, I hope that y'all have a wonderful rest of your day. If you'd like to hear more from me, go ahead and give me a thumbs up, subscribe to my channel so that you can stay tuned whenever I post more videos. I do post videos like this from time to time. I'm going to put the link to some resources that I feel will be beneficial down in the description box below. And I'll also link the feeding and diaper journal down as well, so you can purchase that on Amazon if you're interested. Please, if you want to hear more about a certain topic, feel free to let me know down in the comments below. I do check my comments and I will get back to you as time prevails. Bear with me, but I'll definitely go through them. And if there's any questions that I see or any suggestions for new content, go ahead and let me know and I'll definitely take it into consideration. All right, y'all, till next time.